Yeah, I got it like all there. Okay. So we make sure he doesn't lean back. So I'd like you to sit up nice and tall for me. What I'd like you to do, hands nice there, bring your knee up to my hand, as far as it can go. Good. All right, good. So that's as far as it can go. All right. Can you do that again for me? And then I'm going to give him resistance right here. Ready? Hold. 1, 2, 3, 4, 5, 6. Now I know you guys know that you're supposed to test the other side, but you don't need me to show you that, right?
Right.
Okay. There it is. All right. So if it is hip flexion grade 2, then he's going to be lying on his side. Lay down here. Everybody can see. Do you mind if I take off your shoes?
Yes, actually.
Okay, so we always take off the shoes because that adds that extra weight. Okay. All right, so we're working on hip flexion. Right, my hands are cold, sorry. Okay, so I'm going to support his limb. So if you can give me the weight of your limb. Good. All right. Okay, so what I'd like you to do is I'm starting him an extension. So this is a little bit of an extension, but this leg's flexed because we need him to not be able to roll. All right? Now what I'd like you to do is bring your leg like that for me. Okay, can you do that for me? Let me carry your weight of the limb. Good. Can you do that for me? Bring your knee up towards your chest. Good. Now, do you see what's happening to me in this position?
Mm-hmm.
My back. And now wait, and that's why I also pick somebody who has real muscle mass, so you can see me struggle with this too. So where should I actually be? I'd be in front, okay? Because see how much safer that is on my back? All right, so that is what I would do. All right, now we're going to talk about hip extension, right? What position? Prone. All right, put your leg in your stomach for me. Okay, so what I'd like you to do, and I would be on the side of the limb. You know, slide on down just a little bit so your feet are forward. Toward, yeah, down. Perfect. Okay, there. You want to go under your stomach? Try not to give them anything as far as pillows or anything else goes, if we can, okay? All right, so what I'd like you to do, and of course this would be this leg. Can you guys see me do it on this side? Okay, this is what I'd like you to do for me, please. I would like you to raise your leg up about that high. Okay, see, what am I doing? Making sure this pelvis isn't working, right? Okay, so now I know how much motion there is available. Can you do that? Raise your leg to feel my hand. Good. Keep your knees straight. Hold. Don't let me move you. I'm going to give you some resistance. Hold. 1, 2, 3, 4, 5, 6. And you can see I'm really giving a lot of pressure. But I'm still not going to be able to, I still don't want to put my weight into it completely, because if I put my weight into it, I can't get a real good feel on how much resistance I've given it. Okay? If it's grade 2, we're going to be in a side lying position again. Okay? Do you mind lying on your side again for me? And I am going to jump from leg to leg. That's okay with you guys, right? All right. All right, so he's side lying. This time, I'm going to start him. Make sure that everything's, sorry, I'm poking you, but that's what I do. Okay, so now I'm going to have him go this way, right? So now that I know if you understand it now, give me your whole limb, okay? Whole limb. Some of us can handle this. If this is too much weight for you, because it's starting to even strain me, do it like this, okay? I'd like you to bring your leg back like that for me. Okay, can you do that for me? All right. And we have to keep the knee straight. All right, any questions? No. All right, good. All right, as far as you guys know where to palpate the gluteus maximus, right? All right. Hip abduction. What position?
Sideline.
All right, good. Okay, so we want to make sure. I'm gonna scoot you back a little bit. I want to make sure. Well, what I'm trying to do is keep you from flexed forward. So I'm gonna have this. Yeah. All right. All right. We have to make sure that your knee faces always to the windows. Do not let it roll up toward the ceiling for me, okay? Okay, so what I'd like you to do is do that for me, okay? All right. Stay on that medius. All right, any questions so far? Okay, where should I get the resistance? Okay, one more time. right here. And I'm making sure his pelvis isn't doing anything funky. Hold. 2, 3, 4, 5, 6. Okay, this should be an awfully strong muscle too. All right. If they are very, very weak, then we put them in sideline. Can you lie on your back for me? Okay. What we do is we make sure, okay, we are doing abduction, so this guy won't be in too bad a shape. We're going to start in a little bit of an abducted position. Good. What I'd like you to do is bring your leg out this way. Again, we want to make sure that it doesn't roll out, doesn't lead with the foot. Okay, I've got the whole leg. Can you bring it out just like that for me? Okay? Can you try that yourself? Okay? All right. I was actually giving him resistance because I was trying to slow you down a little bit. Make it look like it's work. Okay, make it look like it's work for me. There. And that's about going to be at the speed you're going to be at. And you see how important it would be that I'm on the same side as the limbs being tested. Okay. Now we're going to do abduction. This is where it gets tricky. All right. So it's going to be. Can you have the flexibility to do that? Yeah. Yeah. Okay. So roll onto your side. If you have a nice athletic, flexible population, you can do this, okay? And then everything's good. Again, Jason's trying to look, so but you would actually have them back a little bit, okay? All right? Okay, but we're going to let Jason look, all right? All right, so what I'd like you to do is bring your leg up just like that for me. Can you do that? Because it's uncomfortable a little bit, and he's not going to have the same amount of motion, all right? Good. And then relax. Okay, this time try it one more time. Hold it up. There's not going to be much motion. Hold. 2, 3, 4, 5, 6. Good. And the other thing that you have to worry about is internal. Obviously, he's not internally rotating. Another thing, if the patient doesn't have that kind of motion available, or you, okay, should really give you a pillow. All right, so what I'm going to have Jason do this time is have his leg up like this. And that doesn't give me a lot of motion. Again, make sure that he's straight. Okay, his pelvis is straight. Okay. I'm going to bring you back just a little bit more, Jason. Your leg, good. All right, bring your leg up to my fingers, please. Hold it up there. Hold. 2, 3, 4, 5, 6. Okay, does that make sense? If you can't. Or if you're lucky enough to have a therapist in your clinic that actually likes you, have them hold it for you. If they would be in front of you, you would be behind. Okay? Do you need me to show that, or does that make sense?
No.
Make sense? Okay, good.
Can I ask aid?
Well, of course. Of course. Okay, can you bring, or you can ask a physical therapist.
Yeah,
too,
but
you know?
just
You can RPT, you can ask them too. They're getting paid. I didn't hear what you said.
Janitor.
Whatever works. Whoever's willing to do it. It's the best.
You probably get that all the
Would using that footstool, would that allow him to like substitute or compensate by adducting that leg and trying to pull up like that?
The limb is so, no,
But
it's so heavy. It's so heavy, you wouldn't have to worry about it too much. You really wouldn't. And also, think about where the adductors are. I could see how you could say that, but actually, in reality, it doesn't happen.
Because if he was adducting the right and trying to like push into the
right, it's
pushing down into that, and then like bring the other one up, like kind of he'd probably like have to use his hips too. But
yeah, you'd see other movement.
Okay.
You'd see other movement.
Yeah, I mean you.
But it's a good idea. It's a good idea. I haven't seen it. I haven't seen that done. All right. So if we're talking about what position gravity eliminated?
supine.
Supine, let's do it. Okay, so you can lay on your back for me. This time, because it's a deduction, the uninvolved leg has to stay out of the way because we're going to be crossing the midline, right? So we support here. What I'd like you to do is bring your leg back for me. Make sure you don't roll your toes in, okay? Keep your toes pointing toward the ceiling. And see how I'm off the table? Okay, can you bring your leg in toward your other leg, please? Jason's being nice to me. He's carrying part of his weight on the limb. He is. That's good. Thank you. I appreciate that. All right. So let's do external rotation and internal rotation. So, yes, if you could do short sitting, I got this. All right. So Jason, substitute away with external rotation. Substitute. So if you're just sitting here and I want you to do this, show me what you're going to do. Oh, well that's perfect, but that's not what I want. Substitute. Substitute. Roll around. There you go. Okay, try it one more time. Okay, so you see, because his foot is telling us where I want you him to put his hands. So Jason, what I'd like you to do is put all your weight on this limb and both your hands on here. Okay, so sit up nice and tall, and this is what I'd like you to do for me. I'd like you to roll your leg out like that. Jason naturally abducted his knees away from each other, but sometimes you have to have them abduct a little bit. Okay? Now what I'd like you to do is try that one more time for me. Good. Just counter pressure. Real force is here. I'd be in front of him. Okay. Try it one more time for me. Hold it there. Don't let me move you. Hold. 2, 3, 4, 5, 6. They're not as strong as you would think. Okay? Not like the last couple ones we were doing. Were you guys able to see that from here, or do you want me to do the other side? Okay. So obviously he knows now. Okay, so this is what I'd like you to do. It's like that for me. And remember, people don't have the same amount of external and internal rotation a lot of times from one limb to the other. So okay, do you see how Jason has less motion here? Mm-hmm. Okay, that's as far as he's going to go. Okay, Jason, can you do that for me? Okay. Counter pressure, force. 2, 3, 4, 5, 6. All right? All right? You don't really have to. Okay, you don't really have to. That was a good question. Towel roll is more important when we're talking about goniometric measurements, so it's parallel, right? It goes right to the hip. Now, internal rotation, same thing, only this time we're going inward. So,
Outward.
Outward. Oh, sorry. Okay, so outward. Let me start with this limb first. Okay, so if he's going outward, okay, you gotta put it on this one. Wherever. Yeah. Okay, so sit up nice and tall for me, because you started doing what everybody thinks. Okay, now roll it out. See, you can't. All right. Okay, so can you roll it out for me one more time? Hold it there. Again, I'd be in front of him. Counter pressure. Force. 2, 3, 4, 5, 6. Okay? Yeah, well, they're not as strong as we think sometimes. Okay? So we're going to have you roll it outward. See, there's more motion there, and then I'm going to give resistance in the opposite direction. Counter pressure, 2, 3, 4, 5, 6. Again, if you know they can do it, but they're not understanding it, they're substituting so much, once you understand that they can do at least a 3, just put them in the position, ask them to hold it. Don't try to explain it to them, because it's very hard to understand. All right, so let's do, last thing is grade 2. So grade 2, if you can lay on your back. This is that tough one. Okay, so Jason, what I'd like you to do is just pretend you're on the beach and let your legs do whatever they want. Good, all right. Okay, so you see how they roll out? Okay, so what we do is we start in full internal rotation. Jason, what I'd like you to do is do that. I will be there, okay? My hand is here. Now we're going to do it to a slow count of 5. Okay, can you do that for me? Ready, and I'll show you. 1, 2, 3, 4, 5. Why am I doing it so slowly? So I can actually catch it, because a lot of times I can't even catch it. Okay, ready, and 1, 2, now I'm giving a little bit of resistance. 3, keep going, 4, 5. Okay, so once they get their toes up, which is 3, start giving them a little bit of resistance. Okay? Internal, we don't have to worry about, so we start in full external rotation. They got to really work those internal rotators to get that foot up. I don't have to do this. Can you just roll foot like this for me? Can you do that for me? I can put my hand here so I make sure that I'm looking at the knee and not at the foot. Okay, but I'm not really doing anything. and everything else is stabilized because of laying on the back. All right, any questions? Let's try it. I'd like you guys to stay here until 9 o'clock, kind of, sort of. I want you to spend at least each of you 10 minutes per person, okay? And then I'll see you tomorrow. Thank you very much.